Welcome back, everyone. We're diving into a chapter from a community health nursing textbook today.
Oh, cool.
Yeah, we usually talk about individual patient care, but this is like zooming out to the whole community.
That's a neat angle.
Yeah, and it's looking specifically at how community health nurses assess the needs of a group.
So, like figuring out what makes a community tick health-wise.
Exactly. And the chapter uses these two projects as examples.
Okay.
The Multilanguage Project and the English Project, both working with new moms.
New moms. Interesting.
Yeah, all living in low-income apartment buildings and, facing different challenges.
Makes sense. So where do we even start with assessing a whole community?
Well, the chapter dives deep into that, but the first thing it stresses is you got to really know the community.
Know it. Okay, so beyond just like basic demographics.
Right. It's way more than just numbers.
Like what?
It's about understanding how people interact, the cultural values, the resources they have, the challenges they face.
So getting the full picture of how things work.
Exactly. And you can't just assume you know what's going on. Like, take the Multilanguage Project.
Okay.
They were working with residents who spoke so many different languages.
Wow, that's a whole other level of complexity.
It is. And they had to figure out how to communicate, build trust, all while respecting those differences.
So cultural competence comes into play big time.
Absolutely. It's not just about knowing different cultures exist.
Right.
It's about weaving that understanding into everything you do, like how you ask questions, how you provide information.
Makes sense.
And then the chapter talks about actually assessing the community's environment.
Environment.
Yeah, like the physical spaces and the social dynamics.
Okay.
One technique they highlight is community mapping. Have you heard of that?
Vaguely. Remind me.
It's like literally walking or driving around, noting what you see, clinics, grocery stores, parks, even just like the condition of the sidewalks.
Interesting.
Yeah, like in the Multilanguage Project, the students noticed right away that there weren't many grocery stores within walking distance.
Oh, wow. Yeah, if you don't have a car, that's a problem.
Huge problem, especially for new moms.
Right.
And then there's this other technique, key informant interviews.
Key informants, so like experts on the community.
Exactly. People who know the ins and outs, like residents, community leaders, service providers, and the Multilanguage Project. They interviewed everyone they could think of. City workers, the head of a multicultural agency, even just volunteers.
Wow, casting a wide net.
Yeah, because each person brings a different piece of the puzzle.
Right, but I imagine those interviews can be tricky. You got to build trust, make sure everything's ethical,
Totally. Informed consent is crucial. And making sure people feel comfortable sharing.
Yeah, it makes you think about your own community.
Right.
Like, who would be those key informants? Who really understands how things work?
Exactly.
It's like everyone has a story to tell.
And those stories can reveal so much about the community's health as a whole.
It's fascinating, really.
It is.
I was thinking about those two projects, the Multilanguage Project and the English Project.
Okay.
They really highlight the teamwork aspect of community health nursing.
Oh, yeah. How so?
Well, the Multilanguage Project team, they seem to just click.
Yeah, they did.
Like, they really understood the community. They tapped into those volunteers. They even, brought them into the assessment itself.
It did seem like they had this natural flow, like they were all on the same page.
Right. But the English Project team,
Yeah.
they had, they had a rougher start.
Definitely.
Conflicts, organization issues, communication breakdowns, the whole 9 yards.
It was like watching a team go through growing pains, but in a good way.
Exactly, because they didn't let it derail them,
Right. They actually use those challenges to learn and grow as a team.
It's inspiring, right? Shows that even when things get messy, you can still come out stronger.
Totally. Okay, let's switch gears a bit.
Sure.
The chapter mentions these advanced assessment methods like focus groups and questionnaires.
Yeah.
Focus groups, I get those. Kind of like a group interview, right?
Yeah, but it's more than just asking questions.
Right.
You're looking at how people interact, how they bounce ideas off each other.
Like a conversation with a purpose.
Exactly. The English Project team used one to get input from the nurses working with the mothers in the building.
Smart move. Tap into the people who are already on the ground.
Right. And they adapted some questions from a previous focus group, even added a new one.
So tailoring it to their specific needs.
Yeah. But it does take more planning. You need a good moderator, someone to record the responses, all that.
And of course, all the ethical considerations still apply.
Informed consent, confidentiality, absolutely. Now, questionnaires.
Yeah, those seem more straightforward.
Right, like a survey. You're gathering standardized information from a larger group.
So more structured than a focus group.
Right. The multi-language project team had this simple one-page questionnaire, all about food choices for new moms, easy to read, focused on their specific needs.
I remember they even tested the reading level to make sure everyone could understand.
Yeah. That's so important for getting reliable data, right? But questionnaires have their own challenges.
Like what?
Crafting good questions, figuring out how to distribute them, analyzing the results.
Yeah, all that data can be overwhelming.
It can. But even student nurses can get involved in analyzing, maybe with help from a faculty member.
That makes sense.
Oh, and the chapter makes this point that really resonated with me.
What's that?
These assessment methods, they're not just about collecting data.
Okay.
They actually guide the nurse's practice.
So it's not just information gathering. It's actually informing how they work with the community.
Exactly. It's about making those connections, using the data to make a real difference.
So let's say we've gathered all this information. Now what? How do they even begin to make sense of it?
Well, that's where the next step comes in, analyzing all that assessment data.
Sounds like a huge undertaking.
It can be. You've got all these observations, interviews, focus group notes, questionnaire responses.
It's like putting together a giant puzzle.
It is. You start by organizing everything, maybe making charts, transcribing interviews, looking for patterns.
Okay, so it's about making sense of all those pieces.
Right. And you have to validate the data, make sure your interpretations are accurate, check back with the community.
So it's not just numbers on a page, it's about reflecting real people's lives.
Exactly.
Yeah.
And once you have a solid understanding, you start formulating action statements.
Action statements, what are those?
Basically, concise summaries of the key findings, like the foundation for the next steps.
So they're like the bridge between assessment and taking action.
Exactly. They lay the groundwork for developing interventions and programs that address those specific needs,
Okay, so they're kind of like a roadmap for what needs to happen.
Right. And of course, you summarize everything in a clear report.
For everyone involved, community members, funding agencies, other healthcare professionals.
Right. So everyone's on the same page.
Yep.
But before we move on to the action planning, there's this crucial element that weaves through the whole assessment process.
Ethical practice.
Bingo. The chapter highlights several key elements.
Like informed consent, obviously.
That's huge. Making sure participants understand what's happening, what the methods are, their right to say no.
And that consent needs to be obtained in a way that respects their culture, their language, their understanding of health issues.
Exactly. And then confidentiality.
Protecting people's privacy.
Absolutely. It's about keeping data secure, but also being mindful of how you talk about the findings, avoiding anything that could identify someone.
Right, because they're trusting you with their stories.
Exactly. The chapter also mentions this concept of reciprocity.
Reciprocity. What does that mean in this context?
It's about giving back to the community,
Okay.
They've shared their time, their experiences, their knowledge, so you find ways to give back.
So like sharing the findings with them, offering them opportunities to participate in the solutions.
Exactly. Or even providing resources that address their needs.
It's about showing that you're not just there to extract information, you're there to be a partner.
Right. It strengthens that relationship.
And then there's cultural humility.
I think this one is so important.
It's a bit different than cultural competence, right?
It is. It's about approaching cultural differences with humility, being willing to learn from the community.
So recognizing that you don't have all the answers.
Exactly. The community is the expert on their own experiences.
It's about being a respectful guest, valuing their perspectives.
Right. Okay. Now we're ready to move on to step 6, planning action.
This is where it all comes together.
Right. We've assessed the community, analyzed the data. Now it's time to actually do something.
To make a difference.
Exactly. And the chapter lays out a really structured approach.
Okay, I'm ready. Where do we start?
Always revisit the overall goal.
Right. Gotta know where you're going.
And remember, that goal should align with the community's aspirations, what they want to achieve.
So it's not about imposing solutions. It's about supporting the community in reaching their own goals.
Exactly. Then you prioritize the needs, because you're going to have a long list.
Oh, yeah, I can imagine.
It's like figuring out which ingredients are essential for a recipe,
You gotta make choices.
Right. Which needs are most urgent, have the biggest impact, are most feasible to address.
Makes sense.
And there's this framework nurses often use,
Okay.
the precede-proceed model.
That's a mouthful.
I know, right? But it's really helpful.
Break it down for me.
So precede stands for predisposing, reinforcing, and enabling constructs in educational environmental diagnosis and evaluation.
Okay, and proceed.
Policy, regulatory, and organizational constructs in educational and environmental development.
All right, I'm officially lost.
I know, it sounds complicated, but the basic idea is simple.
Okay.
Precede is about understanding the factors that influence health behaviors. Why are people doing what they're doing?
So digging deeper, asking why.
Exactly. And proceed is about developing interventions that address those factors, like creating solutions that actually work.
So it's a way of making sure your interventions are tailored to the specific needs and context.
Exactly. It's not one size fits all.
It's like a roadmap for effective action.
Right. Okay, so once you've prioritized the needs, brainstormed interventions, you got to develop a plan of action.
This is where the rubber meets the road.
Right. And again, the chapter stresses community involvement. It's not the nurses dictating solutions.
It's about working together.
Right. Empowering the community to take ownership.
Okay, so how do you build a good plan of action?
Well, you start with specific objectives.
Objectives.
Basically measurable goals, like increase the number of residents who eat 5 servings of fruits and vegetables per day.
So instead of just saying improve nutrition, you're getting specific.
Exactly. That way you can track progress, measure success, make adjustments.
Okay, and then
you outline the activities, what you're going to do to achieve those objectives.
So like offering cooking classes, starting community gardens, things like that.
Right. Be specific about who's responsible, what resources you need, the timeline.
Like a blueprint for action.
Exactly. And you also include a monitoring and evaluation plan.
Monitoring, again, it's like checking in to make sure things are on track.
Right. And evaluation is looking at the overall impact. Did it work? Did it achieve the goals? Were there unintended consequences?
So learning from the experience.
Exactly. And again, it should be participatory, involve the community in assessing the impact.
Their voices matter.
Absolutely. And then there's the question of sustainability.
Making sure those positive changes last.
Right. It's about thinking long-term, building capacity within the community, establishing partnerships, advocating for policy changes.
So it's not just a one-time intervention. It's about creating a lasting impact.
Exactly. But all of this, it can be overwhelming, especially for nursing students who are new to this.
It's a lot to take in.
It is. That's why it's so important to have mentors, experienced community health nurses who can guide them.
So it's about collaboration, learning from those who've been there.
Exactly. Because taking action in community health, it's not a solo mission.
It takes a village.
It really does.
Okay, so we've talked about how community health nurses assess a community, how they plan interventions.
Right.
But now it's like go time.
Right.
Actually taking action.
It is. This is where it gets really exciting, putting all that planning into practice.
And the chapter really hammers this point about collaboration.
Right.
Not just among the nurses, but with the community itself.
Absolutely. It's about working alongside community members, understanding their perspectives, really partnering with them.
So it's not like the nurses swoop in with solutions. It's more like...
It's like walking alongside them, figuring it out together.
Exactly. So what are some of the ways they actually take action?
Well, one approach is community organizing.
Okay, so what does that look like?
It's about bringing people together, helping them identify common concerns, and then, empowering them to advocate for change.
So it's like building a movement from within the community.
Exactly. Community health nurses might facilitate meetings, help residents form coalitions, even train community leaders to advocate for policy changes.
Wow. So it's about building that capacity for change within the community itself.
It is. And of course, health education is a huge part of it.
Yeah, that makes sense.
Sharing knowledge, promoting healthy behaviors, empowering people to make good decisions about their health.
Makes me think of the multi-language project again.
Right.
They had to get creative with their health education because of all the different languages.
Exactly. It's about tailoring your approach to the specific community.
Right. And the chapter also mentioned service provision.
Oh, yeah.
Does that mean, the nurses are directly providing health care?
Sometimes, yeah. They might offer immunizations, do health screenings, provide prenatal care.
It's about meeting people where they are.
Right. And especially reaching those who might have barriers to accessing care.
So it's not just about educating people. It's about making sure they have access to the services they need.
Exactly. And it goes beyond direct service, too.
Okay, like what?
They might advocate for policy changes, be consultants to local organizations, even do research.
Wow, so many different roles.
It is. It's a really dynamic field.
It sounds like you need to be super flexible and adaptable.
You got it. Because taking action, it's not always a straight line, you know?
Right. Things come up, you got to adjust.
Exactly. Just like the English project, remember? They had all those teamwork challenges.
Yeah, but they figured it out.
They did. And that's what it takes, being responsive to the community's needs, being willing to adapt.
And of course, monitoring and evaluation are crucial along the way.
Absolutely. Monitoring is like checking the vital signs of the intervention, making sure things are on track.
And evaluation is stepping back and looking at the bigger picture.
Right. Did it work? Did it achieve the goals? Were there any unexpected outcomes?
So it's about learning from the experience.
Exactly. And involving the community in that evaluation, too.
Right, because their perspective is what matters most.
Absolutely.
Well, this has been a fascinating deep dive, I gotta say.
I agree. It's amazing how much goes into community health nursing.
It really is. And it's not just about nurses, right?
Oh, absolutely not.
Anyone who cares about their community can apply these ideas.
Exactly. Understanding the needs, advocating for change, working together, it all matters.
It's about building a healthier, more equitable future for everyone.
Couldn't have said it better myself.
Well, thanks for joining me on this journey. It's been a pleasure.
It's been fun. Until next time.